It is Wednesday, August 5th, and because it's Wednesday, that means it's Washington Examiner Wednesday here on Jimmy at the Crossroads with yours truly, Jimmy Sengenberger, where we like to talk with somebody at the Examiner about the issues of the day because, let's face it, there's never a dull moment in America right now. There's not a slow news day to be found, especially when we're talking about healthcare news like what we're seeing with the coronavirus. That's why I am pleased today to be joined by Cassidy Morrison, who's a healthcare reporter at the Washington Examiner, to break down some of the latest healthcare-related news. And she joins us now here on Jimmy at the Crossroads. Cassidy, welcome to the show.
Hey, thanks so much. Thanks for having me.
Yeah, Cassidy, one thing for me that really hits at this is that you're talking about a situation where doctors are doing the best that they can given the tools available. And there's a big discussion about patient freedom options that doctors and patients can choose from and not restricting it, especially as we're talking about, these different treatments. Hydroxychloroquine is one that has spurred a lot of controversy, but you've got remdesivir, as you're pointing out. You've got the convalescent plasma therapy. So doctors are really looking for different opportunities to treat their patients. And I think that this goes to the heart of one of the big discussions about giving physicians the latitude to make those decisions, because it's not the first time that we've had a virus or some other disease that people have been faced with where doctors have said, okay, we have no clear-cut solution, but we're going to take some chances with some different opportunities that are presenting themselves. And I just think it goes to the core of a very important debate we're having in America right now over doctor-patient privilege and doctor-patient choice and decision-making.
Yeah, no, you're absolutely right. And it very much is up to the doctor and in consultation with the patient. And, like you said early on, hydroxychloroquine was encouraging in that, patients who took it early enough, and this was, I think before various studies came out that showed it really doesn't make much of a difference in treatment, in recovery time. But it very much was a decision between the doctor and the patient. This is what I think is best for you. And the federal government, I think the Trump administration is really taking that issue to heart, not pushing a specific treatment, even though President Trump did tout the benefits of hydroxychloroquine for quite a while. They're not pushing doctors to stick to one specific idea. Remdesivir is right now the most promising, but it by no means is the only option doctors have. And I think the only issue right now that the administration is really pushing is this vaccine development, which is good because as of right now, about 6 vaccines are entering final stage clinical trials. And there is some optimism in the administration that one could become as prepared as early as, the end of the year, early 2021. So
Yeah.
you're right. It is very much up to the doctor and the patient. But, at this point, it's kind of just trying whatever they think works.
Yeah. Well, and I will quibble just a little bit in terms of the hydroxychloroquine, because we were talking about a paper or an article published in Newsweek a couple weeks ago by a professor of public health at Yale School of Health. He is an epidemiologist who's been published like 300 times. He's reviewed numerous papers. He's one example of several high-level physicians who were saying in the first several days, if you catch it early, hydroxychloroquine mixed with zinc, azithromycin, whatever the combination is, can be effective early on. But when you're getting later on, that's when remdesivir can kick in. Of course, we're talking about these convalescent plasma therapy treatments and different possibilities, especially once you get into the hospital setting when things become even more tense. And so one of the things that we're hearing is that if you're looking at hydroxychloroquine, the only thing that really, the time when that could really be beneficial is preventing hospitalizations. Once you get in the hospital, it's a different animal, and that's especially when the tensions kick in because you're trying to, at that point, make sure that things do not get too serious and that the life of the patient is assured moving forward. Again, Cassidy Morrison is our guest from the Washington Examiner. I'm curious about the vaccine issue because I've been very skeptical about the prospect of getting a vaccine by the end of the year, but one of the articles that you have published in the Examiner, Cassidy, talks about the possible political implications of the vaccine actually coming to fruition and being put out, say, in October, an October surprise of a vaccine, and whether or not that could actually help President Trump in his race for reelection. What are folks saying about that?
Well, it very much is, a miracle best case scenario. I don't think vaccine candidates right now are on track to come out prior to the November election. I was, just trying to get a handle on whether or not this would give Trump this much needed boost in polling, especially in his approval ratings for his response to the pandemic. And what I heard from several people, Bipartisan Policy Center, Heritage Foundation, organizations that are, both more liberal and more conservative. And I heard kind of the same thing over and over. And it's having a vaccine before the November election really wouldn't dig Trump out of this hole that the country is in economically. The damage is kind of done. And, another big issue here is vaccine hesitancy. We saw this a lot when measles broke out anew last year, and anti-vaxxers, for lack of a better term, on social media became very, publicized, and a lot of people are really hesitant to get a vaccine that was researched and developed in less than a year. It remains to be seen whether people will be flocking to get this vaccine once it's ready, even if it's, fully vetted by the Food and Drug Administration. And it, unfortunately, not a lot of people might be comfortable with getting it if it were to be ready by the end of 2020, early 2021, which, from my reporting seems feasible. But as far as Trump's polling and approval ratings, having a vaccine that early wouldn't bail him out of the issues that we're dealing with now that were due in part to the administration's response to this pandemic early on.
Yeah, surely it is an example of one thing that could, along with a bunch of other things, a bunch of other factors, maybe help President Trump in his reelection. But the vaccine issue alone, especially when going to your point about reticence among people, Americans, as to whether or not they'll take the vaccine. There's a new poll that came out yesterday from Yahoo News and YouGov saying that the number of Americans who plan to get vaccinated, if it comes out, say this year, falls to 42%, a new low. And I think that goes to one of the issues that we've been struggling with across this country, Cassidy Morrison, and that is people's faith in our institutions, including the scientific establishment and politicians, and whether or not they feel comfortable taking a step like this.
Right. And we've seen a lot of that in within this pandemic alone. People have been worried that maybe our health institutions, the FDA specifically, are too driven by politics to be giving an unbiased reporting of what might work, what not, what will not work, and steps that they're taking to try and turn this around. I mean, we saw it with hydroxychloroquine, which only recently was taken off the FDA's list of emergency approved treatments for the coronavirus. And you're right, there is pretty widespread apprehension to trust public health, and to some extent, I think that's merited. The public health system across the country has been underfunded for years, and this probably wouldn't have been anticipated much far in advance. I mean, people are hesitant to believe everything that the government tells them, what is a viable treatment, what's a viable vaccine, and it's merited because the public has been led astray a few times when it comes
changing
to
information.
Right, exactly.
Well, one
Right.
thing as well that strikes me is that my research has shown that the quickest vaccine that we got was for mumps, and it took 4 years. So it's pretty
Hmm.
striking if we actually do get a vaccine this year. That's like less than a quarter of the time it took to get the fastest vaccine in the past, mumps, which could raise some of the skepticism where some Americans could say, okay, I want to see how this pans out for people who do take the vaccine first before I decide to take the plunge and jump into it myself.
Yeah, exactly. And again, those feelings of apprehension are completely warranted. I mean, most
Mm,
vaccines take about 10 years to develop,
yeah.
and mumps really was an exception. And I know even some healthcare professionals who feel a little uneasy about a vaccine that has been developed in, 6 months to a year. And it's understandable, I think, especially for those who typically aren't too likely to vaccinate for this same concern. And, I think it's going to be an issue that either the Trump administration or the Biden administration are going to have to deal with almost immediately, if a vaccine were to come out, by the end of the year.
You just watched a clip from Jimmy at the Crossroads. Don't miss more engaging, intelligent talk. Subscribe to the Jimmy at the Crossroads YouTube channel today. You want to catch our live show. And I love your support.
I got Jimmy at the crossroads, making sense out of no sense. Yeah.
Awesome.